over 100 million people in the US who have received a COVID-19 vaccination. Whether or not you get vaccinated is a personal choice, but it's so important to stay informed. So today, we're making sure you have the info you need. This is What's Up, Doc? COVID-19 Vaccines Edition.
Today, we're getting all the answers to your vaccine questions straight from Pfizer's Chief Patient Officer. Please welcome Dr. Dara Richardson-Heron.
Hello, everyone.
Hello.
Welcome to the show, Doc.
Guys.
Okay, let's get straight to it. The CDC has said vaccines are safe and effective, but some people still feel hesitant to get it. I know among communities of color, especially Black communities, there are concerns, even distrust. How do you respond to that?
You know what, Lonnie? Given the magnitude and urgency of the pandemic, we're so thankful for the efforts that have been undertaken to develop a COVID-19 vaccine in record time. But, when it comes to mistrust, I think it's important to provide a bit of context here because, let's face it, many underserved communities, particularly communities of color, have a well-earned mistrust in our nation's healthcare system. The truth is communities of color have not and are not always treated with the respect and dignity we deserve. I mean, think about historical transgressions like the Tuskegee syphilis study, the unauthorized use of Henrietta Lacks cancer cells and others. And, to be honest, there's still continued barriers today. Systemic racism, lack of access to health care, implicit bias in micro, even macro aggression. So honestly, it's not surprising that these unfortunate events might have a negative impact on some people of color and their confidence in receiving a COVID-19 vaccine. So it's really important for us to understand and acknowledge the reasons for this mistrust, but it's equally important for us to find ways to respectfully address the concerns people have and do what it takes to rebuild confidence in our nation's healthcare system so that we can protect our communities from the horrific impact COVID-19 is having right now and also eliminate the many health disparities we unfortunately continue to see in Black and Brown communities.
Absolutely. Dr. Dara, can you walk us through exactly how the vaccine works so we get a thorough understanding?
Yeah, I'd be happy to. I get this question a lot, and I find that it always helps to break down the science a bit. So here's what happens. You get a shot of the vaccine into your arm. The vaccine gets into your cells and teaches them to make a copy of a part of the COVID-19 virus called the spike protein. The spike protein is the part of the virus that makes us sick. Think of this like a recipe or instruction set or a blueprint. And so now after your cells create a copy of the spike protein, it's released into your bloodstream and your immune system, which of course is the part of the body that helps us protect ourselves from disease, it recognizes the spike protein as foreign and creates a response. And the hope is that if you're ever exposed to the real COVID-19 spike protein, your immune system will remember that copy of the spike protein that your body made after the vaccination and take steps to protect you from developing COVID-19. And it's important for me to note right here that the vaccine does not contain any COVID-19 virus particles. So you can't actually get COVID from taking the vaccine. And also the vaccine doesn't change your DNA. These are misconceptions we often hear about.
You mentioned that you were able to make the vaccine in record time, but normally it takes years to develop a vaccine. How were you able to move so quickly?
Well, first of all, thanks to new approaches like the use of mRNA, which is messenger RNA, to develop vaccines, our teams were able to move quickly and safely, and that's very important. Let me be clear, we did not cut any corners. Our teams performed many steps in parallel rather than sequentially. And we also took the risk to begin manufacturing the vaccine even before it was approved and authorized so that we would have it on hand and ready for immediate distribution once the regulators gave it the green light. And keep in mind that the usual drug development journey, the process of preparing regulatory data packages and information to submit to the Food and Drug Administration and waiting for the response often takes months. But given the urgency of this pandemic, regulators reviewed and responded to data very quickly, often in real time. And all of these things taken together help to speed up the vaccine development process tremendously.
Yeah.
Dr. Dara, I'm curious, when you're developing and testing the vaccine, was there enough diversity among the participants? Were people of color represented?
You know what, Garcelle, this is such an important question. And the answer is absolutely and yes, because,
Good.
when people from all walks of life are not included in clinical trials, it's much more difficult to understand how a particular drug or vaccine may impact different individuals or
Mhm.
groups. And, there's something I always say, and I say, if you're not part of the research, you may be less left out of the cures. And that's why
Right.
our research teams were very intentional about ensuring
Yeah.
diversity in our COVID-19 clinical trial. Let me give you some data. The good news is that 30% of our US clinical trial participants came from diverse backgrounds, and that included 10% Black, 13% Latinx, 6% Asians, and 1.3% Native American participants. And I need to point out
Oh,
that
wow.
this is a really, really good outcome. These numbers are significantly higher than the average minority clinical trial participation rates that we see in the United States.
Recently, the Biden administration announced that the COVID vaccine will be available to all adults in the United States. So, Dr. Dara, what is the one main thing you want people to know?
Well, Lonnie, let me say first, from my personal perspective as a physician, vaccines have historically and will continue to play a vital role in keeping us, our families, and the world healthy. And the one thing I want people to know is this: COVID-19 is real. We have all seen the devastation this pandemic has
Yeah.
caused. No one has been
Yes.
spared the sadness and grief far too many families around the world are experiencing as a result of lives lost way too soon. And look, I know
Yeah.
that many of us are counting on vaccines to help us get to the other side of this pandemic,
Yeah.
but the reality is vaccines don't prevent disease. Vaccinations do. And we need vaccines into arms so that we can see the light at the end of what I think we can all agree has been a really dark tunnel. So I
Yeah.
personally encourage everyone to consider seriously getting a COVID-19 vaccine as soon as you can. And for anyone who has more questions, you can visit covidvaccineproject.org to learn more.
Absolutely. We so appreciate you stopping by, Dr. Dara, and informing us on this very, very important topic. Real fam, you can also head on over to thereal.com for more information.